Well, I think that is definitely a worst case scenario. I don't think that it's likely to get that high, but certainly we're already seeing in certain states, particularly states with very low vaccination rates, because the vaccination rate does vary across the United States. Again, big waves of hospitalizations, ICU usage, and even on Twitter, doctors calling out for help with people coming to provide medical care in their regions. Although the vaccination rate is not what they want, they do have almost half of the people fully vaccinated and 57% having had at least one vaccine, and that's much higher in the high risk groups. So the groups of people that are more likely to die of the disease. So more of them have been vaccinated than that. So while the cases may be very high, I don't think we're going to see the deaths peaking anywhere like near what we did in that awful wave when we had up to 5,000 people dying a day in the United States.
How likely is it that vaccinated people transmit COVID? To what extent might this rise be contributing to the high number of cases we're still seeing in countries such as the US, UK, and also Israel, which have vaccinated a higher proportion of their populations?
Yeah, well, United States declared a while ago, about 6 weeks ago, that vaccinated people no longer had to wear their masks because they were thought to be at low risk of getting COVID and certainly of transmitting it. But now what we're finding is with the Delta variant, it seems the vaccines seem to be less protective. And the data coming out, it's a bit conflicting. In the UK, if you've had two Pfizer, almost 90% effective. In Israel, it was more like in the 60%, but then more recent data from Israel has it more in the 30%, indicating that the effectiveness seems to be going down for getting COVID. Now, still very effective for getting serious COVID, so for ending up in the hospital or dying of the disease. Importantly, in the United States, over 99% of people who are dying of COVID right now have not been vaccinated. Vaccines are extremely effective, but they don't seem to be able to eliminate your chances of getting COVID. You may get mild COVID if you have vaccines, or even rarely get serious COVID, but mostly it's mild, and it can transmit. That's what we're starting to find. You can transmit to people who are unvaccinated. You can even transmit to people who are vaccinated. So, the question is whether this is waning immunity, whether our immune system is just losing the effectiveness of the vaccine, or whether it's the new variant. But in any case, it does mean we need to be vigilant even if we've been vaccinated.
So in a sense, would you say that vaccines give those who've had it a false sense of security? How cautious do we need to be? And is that why the US are looking at reintroducing masks?
Well, I think most transmission is from unvaccinated to unvaccinated. That's the most likely way transmission happens, particularly in a place where you have so many people unvaccinated. But when you get up to high numbers of vaccinated individuals, it becomes it'll become a bigger part of the transmission that happens. So people who are unvaccinated may get it from people who've actually had the vaccine. So I think just what it shows is that we're going to probably need some things like masks for the long term. And likely the CDC in the United States was premature when they said that vaccinated folk could take off their masks. It probably isn't, it would not have been the right time to have done that.
And Nancy, when are experts predicting that the current vaccines that we have will no longer be as effective? What happens then? Do we just need to keep taking booster shots?
Yeah, I think that that's what most people are thinking is the likely scenario, that it won't be, two shots and you're done for the rest of your life. And there are two reasons for that. One is this, what they're calling waning immunity. So your immune system just loses its ability to fight off COVID after the vaccine, after a while. And we know there are some vaccines that we take ordinarily that have that effect. So, you have to keep getting your tetanus vaccine, periodically if you hurt yourself to prevent you from getting tetanus. So that happens with vaccines. But the other thing that's concerning is that, the new variants the vaccines are still effective, but they seem to be less effective against them. So it's a combination of the two. It's the potential waning immunity and also the new variants. Definitely the vaccine companies are making new versions of their vaccine, so are effective against the new variants. And there's no reason to believe that, having a booster of the vaccine that you already received won't boost your immune system. That's what they're actually now recommending for people who are immunocompromised. So people say who've had chemotherapy for cancer or transplantation. In some jurisdictions, they're now thinking about recommending those people have a third dose, so a booster, to try and kind of elevate their immune system and help them fight it off.
And as you mentioned, scientists are now looking at developing vaccines to fight against future variants. So that is something that they can develop, or do they have to wait until the variants themselves emerge?
Yeah, I mean, in most cases, they're waiting for the variants to emerge and then developing vaccines against those. But there are some people trying to develop a more kind of omnibus, overarching vaccine against a COVID-19, so it doesn't affect areas that are so frequently mutated or potentially has more spike protein included. So maybe more effective against more variants. So you won't need to have it updated as quickly. Lots of people are working on this. But again, to emphasize, the vaccines remain extremely effective against serious disease, and over 99% of people dying in the United States of COVID are currently unvaccinated.
And just finally, how safe are the current vaccines available for children, and from what age would you recommend that they receive them?
Well, so we have several vaccines that are approved for children aged 12 and over, and we now have Pfizer approved in Australia for use in children 12 and over. And I think it's excellent. It's excellent that we have vaccines that can cover that age group. They've been found to be effective in terms of generating an immune response, and also to have a low side effect profile. So for Pfizer, it's definitely very similar to the side effect profile in adults, maybe even milder. And so, we know that teenagers can get COVID. We know it can be serious. The other thing is that we think children can get what's called long COVID, where, you have some symptoms after you've developed COVID-19, fatigue, weakness, difficulty breathing, that can last for a long time, many months. So you're not back to normal for many months. It doesn't happen to most people, but it does happen to some. And the vaccines seem to help prevent that as well. So there are a lot of reasons that vaccinating children is likely going to be worthwhile, but we're not going to be vaccinating children, in the very near future. We're obviously going to be focusing on adults first in Australia, and there hasn't been a decision made to vaccinate children.
Nancy Baxter, thank you so much for talking to us tonight. Really appreciate it.
Thank you.